Zurzuvae, a new pill for postpartum depression, PPD. 1 in 7 women experiences postpartum depression after childbirth. Zurzuvae is a new pill that can help alleviate severe symptoms and improve overall quality of life. What is postpartum depression? Definition: postpartum depression is a mood disorder that affects women after giving birth, causing feelings of sadness, anxiety, and exhaustion that can last for weeks or even months. Prevalence: approximately 15% of new mothers experience postpartum depression, making it one of the most common postpartum complications. Impact: postpartum depression can have a significant impact on both the mother and the baby's health and development if left untreated. Signs and symptoms of postpartum depression. Emotional symptoms: feelings of sadness, emptiness, and hopelessness, mood swings, irritability and frustration, and thoughts of harming oneself or the baby. Physical symptoms: fatigue, sleep disturbances, appetite changes, and difficulty concentrating or making decisions. Anxious symptoms: panic attacks, racing thoughts, and constant worry or fear about the baby's health and safety. Current treatment options for postpartum depression, PPD. Talk therapy. Counseling with a mental health professional can help new mothers express their emotions and learn coping strategies. Medication. Antidepressants may be prescribed to alleviate symptoms, but many have side effects and may not be safe for breastfeeding. Support groups. Joining a support group with other mothers who have experienced postpartum depression can provide a sense of comfort, connection, and validation. Standard treatment includes counseling or antidepressants, which can take weeks to work and don't help everyone. What is Zurzuvae? Containing zuranolone. Zurzuvae is a new drug recently approved by the U.S. Food and Drug Administration for adults experiencing severe depression related to childbirth or pregnancy. Dosage. The daily recommended dose for Zurzuvae is 50 mg. It should be taken once every day, for 14 days, in the evening with a fatty meal. Cost. The new pill is from Sage Therapeutics, which has a similar infused drug that's given intravenously over 3 days in a medical facility. The FDA approved that drug in 2019, though it isn't widely used because of its $34,000 price tag and the logistics of administering it. How Zurzuvae works. GABA, a receptor-positive modulator. Zurzuvae is a neuroactive steroid gamma-aminobutyric acid, GABA, a receptor-positive modulator. The mechanism of action of zuranolone in the treatment of PPD is not fully understood, but is thought to be related to its positive allosteric modulation of GABA-A receptors. Clinical trials and efficacy of Zurzuvae. Positive results. The FDA's pill approval is based on 2 company studies which have shown that Zurzuvae can significantly improve symptoms of postpartum depression in women compared to a placebo group. Enhanced approaches. Zurzuvae can also enhance the effects of talk therapy by improving the brain's receptiveness to counseling and cognitive behavioral techniques. Fathers and families. Zurzuvae can also improve family dynamics by reducing stress levels in both mothers and fathers and promoting a more cohesive and supportive home environment. Common side effects. The most common side effects include drowsiness, dizziness, diarrhea, fatigue, nasopharyngitis, the common cold, and urinary tract infection. Ability to drive and perform other hazardous activities. The labeling contains a boxed warning noting that Zurzuvae can cause somnolence and confusion and impact a person's ability to drive and perform other potentially hazardous activities. Patients also may not be able to assess their degree of impairment. To reduce the risk of harm, patients should not drive or operate heavy machinery for at least 12 hours after taking Zurzuvae. Risk of suicidal thoughts. Zurzuvae may increase the risk of suicidal thoughts or actions in some people, especially those with a history of depression or bipolar disorder. Close monitoring by a healthcare provider is essential. Fetal harm if used during pregnancy. Zurzuvae may cause fetal harm. Women should use effective contraception while taking, and for 1 week after taking, Zurzuvae. Drug interactions. CNS depressants. Concomitant use may increase impairment of psychomotor performance or CNS depressant effects. If use with another CNS depressant is unavoidable, consider dosage reduction. Strong CYP3A4 inhibitors. Concomitant use may increase the risk of Zurzuvae-associated adverse reactions. Reduce the Zurzuvae dosage to 30 mg orally once daily in the evening for 14 days when used concomitantly with a strong CYP3A4 inhibitor. CYP3A4 inducers. Concomitant use may decrease the efficacy of Zurzuvae. Avoid concomitant use. Lactation. Available data from a clinical lactation study in 14 women indicate that zuranolone is present in low levels in human milk. There are no data on the effects of zuranolone on a breastfed infant and limited data on the effects on milk production. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for Zurzuvae and any potential adverse effects on the breastfed child from Zurzuvae or from the underlying maternal condition. Conclusion. Zurzuvae offers new hope for mothers struggling with postpartum depression by providing a safe and effective treatment option. Although side effects and risks should not be ignored, the benefits of treating postpartum depression can greatly improve a mother's quality of life and overall health. If you or someone you know is experiencing postpartum depression, talk to a healthcare provider about the treatment options available. Note: this video is intended for informational purposes only and should not replace professional medical advice. Always consult a healthcare provider for personalized guidance. Thank you for watching. Please like, share and subscribe.